Talapalava, malo le sulpua manilangi e mama, o lo uingo o Malia. And so I'll be briefly going over the research I did for my master's, and that was to understand the experiences of Samoan caregivers taking care of their loved ones with dementia. So my interest in this topic, it stemmed from my personal experiences. My family and we cared for our late Nana, who was diagnosed with dementia. And so she was really the driving force behind this research. During that sort of season of our lives, it was quite rocky for us, especially when it came to trying to access support or seek services, that cater to our needs as a Pasifika family. So yeah, as a Tamaita'i Samoa, I feel that this research or doing research is my way to tautua my community, to serve my Pacific community, no matter how small that may be. So for my research, I honed down my focus to Samoan caregivers in the Auckland region. I was very fortunate to have 8 wonderful families who reached out to me and who met the inclusion criteria. And I had one-on-one Talanoa sessions with them. So here, this image essentially depicts the key findings of our family caregiver experiences, and that the cons outweigh the pros. And it's a sad reality for our family caregivers because they are heavily depended on by our healthcare system, but I feel like they're not fairly compensated for their work or contribution. These are families that I interviewed 4 years after my own family's experiences, and there wasn't much difference in terms of having improved systems in place to access support or services. Now everything was just a mission back then, and it seems that was still a mission even now for our family caregivers. And the how. So here's just a list of some key changes our family caregivers would have loved to see to improve their experiences. What stood out for me was having a dementia community, something specifically tailored for our Pasifika dementia family caregivers. Just having a space to connect with others alike, to receive that support, and just a place to de-stress. What I found in the Aging Well report was that caregiver distress is enduring. And so, maybe these are ideas based on family caregivers' desires for better support that could maybe potentially help with that. And so most of these points on this list, they actually align with what's already pointed out in our Mahi Aroha Carer Strategy Action Plan. And so I feel like this research, I guess, further amplifies the need to invest in supporting our family caregivers. What's next? For me, I feel like it's just further research in this area. Hopefully one day PhD studies for me, with a focus on a Pacific approach that best supports our dementia family caregivers. And hopefully another day, that research will help tip the scales, and our pros will outweigh the cons.